Amanda, how are you today?
I'm good, thank you.
Alright, perfect. So after going over your assessments and everything, I have found a few things that I'm a bit concerned about. We can treat them, we just need to be a bit more careful on your routine and everything. So the first thing I found was you're a bit at risk for gingival trauma and recession. Are you aware of what recession is?
Kind of.
Yeah, can you elaborate it on a bit for me?
When more your tooth starts showing than should
So
be.
you're on the right track. So this is actually in relation to the erosion you have modified by your dental routine where you're brushing 5 times a day and also your systemic disease. Do you understand what I mean by that?
Yeah.
Alright, perfect. And then also moving on, you've told us that you have a bit of a dry mouth. Yeah, so we call that xerostomia in our field. It's in relation to your mouth breathing and also some of the medications you use. Is there anything that you personally feel affects your mouth because of the xerostomia?
Yeah, I just feel like very pasty and like I have problems swallowing. Sometimes talking, I feel just very dry.
Okay, perfect.
Like a desert.
Yeah, so right here I actually have a bit of a diagram for you. So this is what xerostomia is. So it's a lack of salivary flow and production resulting in the dry mouth. And a lot of the time,
that's how I feel.
That's how you feel. A lot of the time it is from your medication. So I think I'm going to actually refer you to your doctor just to see if we can look at dosages and everything from there that can kind of reverse the effects of xerostomia. Also, with xerostomia, it can put you at risk for dental caries just because it is so dry and you don't have the saliva there to like clean your teeth as a natural cleaner. So you commonly know them as cavities. Ultimately the tooth is decaying, unfortunately, but that can always be reversed. Like I said, we'll teach you some ways in the treatment plan to teach you that.
Good.
So I'm just going to go over a few things we're going to be doing to actually reverse both those things I just talked about.
Yes, please.
So to start, we're actually going to do some debridement. There is some risks and benefits to it. The risks are you can have some inflammation of your gums, a bit of bleeding too if it's a bit invasive, and in a very rare case infection, but there's probably not going to happen because we are very careful here. And then also we are going to do a fluoride treatment just to help with the erosion and everything, to remineralize your teeth. There is some risk and benefits with that too. The benefits outweigh the risk for both of them. The benefits is for the fluoride is it actually remineralizes your teeth. And we just paint it on nice and softly. You will have to wait 2 hours after getting it applied before eating or drinking, and we do suggest you to eat soft foods afterwards. The risks are if you do ingest the fluoride, you will have a bit of an upset stomach. It is kind of common if you aren't too safe with it, but we will have a lot of suction there to help with that. If you do go home, you are experiencing this, just drink a cup of milk. If in an hour or two you're still not feeling well, we do advise to get medical help, but we should be able to stop that from happening. So in regards to appointments, our first appointment, I'm going to do your debridement on your first and fourth quadrant. So that's going to be this side of your mouth on the top and then the bottom side here on the bottom. And then when you come back again, we're going to do your debridement on the other side. So the top and bottom of these ones. Alright?
Alright.
Perfect. And then once we're done that, I'm going to, on our second treatment, I'm actually going to do the fluoride varnish like I just said.
The paint.
Yes, the paint. Perfect. And then after that, I'm actually going to want to see you back in about 2 months just to make sure that we've gone over everything, you're staying healthy with your mouth, if you've seen your doctor or not, to talk about your dosages and everything. Does that sound okay?
Yeah, sounds swell.
Alright, so just before moving on to this appointment, I do need you just to consent to it. I just need you to sign the paper right here for me, if you don't mind. Alright, perfect, Amanda. We'll get started.
Oh, thank you.